Our friends at MyCare Medical are growing, and I am so excited that we get to welcome one of their new doctors to our show today. And of course, if you're not familiar with MyCare Medical, they focus on active seniors and keeping seniors healthy and having them have a transition into those later years of their life and doing it in a smart way. And Dr. Joy, the new doctor, is with us now, along with our friend, of course, James Dubrey, the VP of Sales and Marketing. Dr. Joy, James, good to see you. How are you today?
Great. Fantastic.
Well, Dr. Joy, as we get to know you a little bit, I feel like the best way to do that is to talk a little medicine, right? And of course, who cannot talk about the heat that is happening right now in Tampa Bay? We know the summer months. Seniors need to pay special attention to the temperatures, though, don't they?
Yes, they do, because the way fluid balances occur in seniors is a little bit different from the younger people. So it's very easy for a senior to get dehydrated. It doesn't take much at all, which means during this time, they need to pay attention to their fluid intake. They must pay attention to how much is being lost when they are outdoors. Sometimes it takes a while for the symptoms of dehydration to kick in. So it's helpful when there's somebody around saying, Grandpa, you've been out here for more than 45 minutes. Maybe you need to go get a drink of water, or you need to get into the shade or get in the house in the AC for a while. So somebody needs to monitor those. Fluid replacement, again, in the senior adult is important because most of these patients are on a ton of medications, some of which have side effects. And so when you get dehydrated, all of those come into play, and there are pretty disastrous consequences. So again, knowing what medications our relatives are or our neighbors are on, it's important so that we can advise them about their fluid intake a little bit better. Some of these patients may be on diuretics because they have CHF, heart failure. So again, we need to monitor how much fluid they're putting in regularly. And then, of course, when they have to be outdoors. And of course, you don't have to be outdoors to lose fluid through your skin. It's a natural process that goes on. And so, yeah, we need to monitor those. Fluid balance, you don't have to you don't have to drink too much water to feel the effects of it. The problem is how to balance how much you put in versus how much is coming out. The average person or the average kidney would excrete about 2 liters of urine a day. So if you're putting in more than that in terms of how much you're hydrating, it just means you're going to spend a lot more time in the bathroom. And again, in this age group, we have to be careful because going to the bathroom is already an issue. Everything slows down once you get to 65. And so the number of times they have to get up, go through that trouble with all aches and pains, walker, wheelchair, all of that, going to the bathroom. And we have younger relatives, friends, neighbors telling these patients to drink a gallon of water a day. No, that's not for this age group at all. And so we have to monitor. If you're having to go to the bathroom more than 6 times a day, you're overdoing it.
Well, Dr. Joy, we wanted to get your medical take on an important topic. And, I've been able to talk with James for a few years now. James, you have so much passion for MyCare Medical, especially when it comes to a new office in Clearwater with a new doctor in Joy. I mean, this has got to be an exciting time to see MyCare continue to grow.
Extremely exciting. You can hear the passion in Dr. Joy's commentary there. You can see her wealth of knowledge about how to manage seniors and get them healthy. This is exactly what I've been talking about every time I come on the show. It's about the quality of the physicians and them getting out into the community and meeting the people in the community and serving them at their time of need. So, Dr. Joy, we're so honored to have you on board, and I'm so glad to introduce you to the community through this television show right now. So welcome. She's exactly what we needed, and we're so glad to have her on board. We want to make sure the community knows that she's available. She's knowledgeable, she's compassionate, and she's part of MyCare Medical.
I love it. There you go. Welcome, Dr. Joy. James, as always, thanks for being with us. Of course, that's how you can get in touch with MyCare Medical today.
Thank you so much.
Thank you so much.